Apollo means trust. Apollo means quality. Apollo means clinical excellence. Whatever you're doing, be satisfied. Because the kids look upon you not just as a father, but a father who has a time for the kids. Because by end of the day, even if people don't tell you you're doing wrong or right, you yourself know you have done wrong. Here, elderly people used to get heart attack. Today you find 22-year-old male coming with heart attack. That's a point of worry. Generalized sweating. I mean, sitting in an AC, somebody sweats. So even that as a sign can be looked as the patient may be having heart attack. We have seen people walking into the hospital, suddenly dying out, and a very young soul dying out is not a thing which anybody would accept. Today, we are looking at expanding hospitals. Okay, we talk around new hospital is coming up, which is 1,000 bed. New hospital is coming up 500 bed. So are we dealing with the problem, or are we saying let the problem grow and we are growing the hospitals?
Welcome to the OP podcast. Today, we are joined by a leader who stands at the intersection of medicine, management, and mission driven healthcare. Dr. Alok Srivastava, Chief Operating Officer and Director of Medical Services at Apollo Hospital, plays a pivotal role in shaping one of the India's most trusted healthcare system. From hospital operations and clinical governance to patient safety and innovation, Dr. Srivastava brings both doctor's empathy and administrator vision to the table. Sir, how are you?
Fine.
Sir, before the titles and responsibilities, we all want to know who is Dr. Alok Srivastava as a person.
So I would say I'm a family man, but my key interest would be in traveling, which I do make it a show that every month I do some new areas to travel, so as to understand people. That's one thing is my avid traveler you can call. I have a collector as a key feature. I keep on collecting stamps and coins, and I am an avid shopper also. So wherever I go, I make it sure that I bring something for my family with certain choices, and I have good collection of artifacts.
All right, sir. So, since you are now CEO of Apollo, and like, what drew you towards medicine?
It was never my choice. It's you can say it's by chance because I wanted to become an administrator, but not through medical systems. I never thought that medicine would ever give me that opportunity. So when I went and wrote my PMT pre-medical test with the intent that I should not get selected, I got selected in three medical colleges, and I had no choice because you can reject one, but how can you reject three in front of a family? Because typically any family will say that okay, doctor, you definitely is a number one choice that you should take. So ultimately, I picked up medicine. But as the destiny would be, God wanted to make me administrator, and I actually post graduated from business school, and my life changed after that. So I moved into administration, which was my first
When
choice.
did leadership became your part of your journey?
Okay, so leadership as a skilling, I learned it from the people who made me move into this. So I moved my journey 20 years ago when I joined a leading healthcare organization. My mentor was the chief executive. So I used to work with him, and I used to drive medical administration. So he groomed me like a hand holding as a fatherly figure. He guided me. What are the important things that you should focus on? Was he was very open to talking. So I realized that when you're leading something, you should be very open. Otherwise, it doesn't work out.
Was there any moment in your career that changed how you viewed the healthcare system?
I think it's important to share now because this is a very important question from my perspective. When I look at my journey, I it sh- it shaped up. I mean, from the very beginning when I moved in the first healthcare system, because I was undergoing training for some so-called selection process where people have to go and be trained in an international standard. So the training continued for 6 months, and I was the junior most in terms of holding a qualification. We had people who were postgraduates, We had people who were super specialists. And so we never thought of that out of 14 people, my name would ever reflect in further training. So the selection process was such that people from abroad, two chairmen came from a leading healthcare organization and they took the final exam. When they took the final exam, my name was number one. So I was wondering how come my name came one. Number one was I'm not expecting at all. So I asked the question very directly to the chairman because he was very open. And he said, Alok, we drive ethical systems. And ethical system means choose the person who can do it the best. It's not the qualification which guides. So I was really amazed to hear those words. I mean, as a person who is beginning his career, is getting to know from somebody who's very senior that he has chosen me, where I didn't have any expectation at all. So I said, if somebody's picked me from that point, that seeded in my mind that ethics is very important. And so that was a turning point in my way of viewing healthcare. And I've carried it along. It's really worked well because today, what I hear mostly is people talk about ethics, but ethics is a very vast subject which
Yes.
we really don't understand.
Have you ever faced dilemma, like the ethical dilemma in your career?
It comes quite often,
Quite often.
and it comes when you know your people, and when you know your people, they come or face situations, and they come to you asking for a response. So when they ask you a response to it, you have to be judgmental in giving the right decision. You know you have somebody who's very close to you, but is not right. But there's somebody who is not known to you, but is very right. And then you have to make a judgment that, okay, let me give the right answer. It may annoy you with the person who's working very closely with you, but then you have to give a right judgment. So at times it gets stuck up, but mostly you sail through.
So, what values did you use, or did you take it as a guiding pillar for making the decision,
Most important thing is doing the right thing.
doing right?
Because see, in medical system, I can't afford to carry a wrong decision. When you are working as a leader in any position, you're looked upon as a guidance path. So if you're looked at as a guidance path and you have 2000 cameras watching in you, which is equivalent of every employee, because there was a time when we were not having connect through WhatsApp. We were communicating manually. Only when you meet, you understand what is happening around. Today, communication is so rapid that you have spoken a word right now, next moment it is on the WhatsApp of 1000 people. So if that is the rapidity of communication, you have to be very clear that you should not do anything wrong when you're holding a position. And I made in my mind when my selection was being made that I'll not try doing anything which is wrong. Because by end of the day, even if people don't tell you you're doing wrong or right, you yourself know you have done wrong. And that hurts. So better do a right thing in one go rather than doing in steps.
So now we will discuss about your roles at Apollo Hospital as CEO and Director of Medical Services. What does your typical day look like?
So I must first start by telling it's typically mentioned about healthcare systems 24 by 7. So when I was picking my journey in management, I thought a day would be cool, and even if hectic, night would be mine. But that definition didn't last long, and typically the day used to end after 16 hours of working. Today, I would say it's 24 by 7 is a definition which is applicable to person who is driving the hospital, because you are responsible for answering your patients, to your family, to stakeholders, to public systems. So with so many answerability, it's very difficult to understand that which time of the day you are going to end, which is typically being so long that I should say 16 hours is a normal routine working, in which it's not that you are working continuously, But it's the system is like that. It never gives you a space that you can take a stretch of break. But overall, it's 15, 16 hours of working which goes.
How do you maintain the uniform standard all across?
Yeah, I would say that's our niche, and that's what we are known for. Because Apollo has got levels of management. One which is a unit level management, and secondary is a central level governance. So central level governance sets the policies and standards which every hospitals maintain. So there is a uniformity in the way we administer the care, we monitor care, and we evaluate how the outcomes are. When I say evaluation, that's a typical process that we drive in our systems methodically, involving teams, which involves medical services, and also involving doctors, which are clinicians driving the patients, and also involving the leadership, which review the way we are driving care. Because the way we evaluate is in the form of tangible care. That means if you are evaluating something in terms of patients, people typically would say that, okay, how many patients entered into the hospital? But we evaluate not just by numbers, we evaluate was the patient given medication on time. I'm just saying with an example. Did the patient had a proper outcome? Was the drug given for a particular case on time? So we are that precise. So if you are actually measuring all those values and subsets, it becomes a very micro level clinical excellence program. And we typically have a Apollo clinical excellence program, which we run. And every month we have a score that we generate out of it. So every unit gets a scorecard, which says that, okay, your clinical performance is like this. So if that is the system, I think it's not easy to be driven. Secondly, it is also telling the team which is performing in the unit that you have to look everywhere. You can't leave any corner, which becomes a blind spot. And that makes us really different in the way we deliver care. Not just saying that, okay, doctor has written a prescription, the nursing has given the medication, the story ends. So it's a very robust, in a nutshell, very developed program that we drive Apollo Clinical Excellence, and that has closer to 68 parameters that we monitor every month.
You involve yourself personally in clinical governance, so and quality assurance also. Has that ever time come that you felt like this could have been done better?
I would respond by saying that whenever you're trying to do anything which is a benchmark against a benchmark, then you always look for improvement. Means today my benchmark is, let's say, 3, tomorrow my benchmark becomes 2, and I break my own benchmark saying it I carried 1. So that's one way which is internally I try to improve. Or Kaizen process, where you improve your standards and typically work. Second way that we do is we have international benchmark systems. So when I shared 68 parameters being evaluated against a standard international performance, it is coming from whichever country is delivering the best standards and whichever we adopt that, and we drive internally and we evaluate whether our performance is in red, yellow, or green. So definitely point comes when we get stuck up, but then we do a RCA, root cause analysis, to identify where we have to improve, and we do improvement process. So in a nutshell, every month there's an improvement. We never say that we have delivered the best and we don't want to improve. So team also improves and definitely systems also.
We also have different healthcare chains in India. How different do you think Apollo is from them?
In one way, I would say that we have systems where we deploy something which people need to really understand. That Apollo means trust. Apollo means quality. Apollo means clinical excellence. Apollo also means Apollo, we never sleep. That means we are there for delivering the best healthcare that comes through trust of the people. and it goes a long way because people trust us. Apollo is one name which I have heard for so many years, and people come here just for ensuring that they are in the best hands. So, that kind of trust is one differentiator, key differentiator, which I find places us uniquely.
But how affordable are these services?
See, today, affordability is a very relative question. I'll explain why I'm saying so. Because when you say affordable, a person would like to shell out money for spending on the weekend by spending 20, 50,000 without worrying about it. Okay. But when he has to undergo health checkup at a price of 10,000, he'll always say that I need a discount. So although he can afford 10,000, but he's looking for a discount, there's one way of looking at it. When you approach for a weekend enjoyment, you never ask for a discount, despite the bill may be 20,000.
Mhm.
So people over here really don't understand what to a level that what healthcare subsets are. One part is definitely care, but the care which coming with embedded safety, embedded quality has will come at a cost. It can't come as at a price which person has his mind, because today typically it has become a commodity where people want to just do a Google and say that they are getting an answer, okay, what is it? And they will put a second question, what is the price point? And they will get a differences in the price point. So they're understanding we are costly. But actually it is a cheaper healthcare. When I say healthcare cheaper, it means affordable. So affording something is really very important, but it definitely comes at a price which people can afford mostly. I'm not saying that entirely. And today, with leverage of insurance, it's become better. It's becoming better with the kind of coverage. Definitely, when you look at quality, you have to ensure that it is affordable. And today, mostly people who understand quality, they definitely come blindly to Apollo, saying that they would like to invest first in trust and then be aware that everything is well off.
We are seeing AI, we are seeing robots and digital records. So, how Apollo is using those in improving the medical healthcare system?
So technology is becoming very relevant from two perspectives. One perspective is it is easing out diagnosis, and also it is efficient in telling you much accurately what is happening when you want to scan the masses. Today, people focus on care, which is typically management of diseases, but actually management of health is missing. So everybody is looking at hospital, okay, when somebody gets a disease. Ideally, today they have to focus on prevention, which is missing. We are using AI to augment the prevention by knowing what is the prediction of somebody getting a heart attack through various parameters that we analyze in preventive health checkup. If that be the model in the country which is adopted, then you'll realize that people will get a lesser chance to come to a hospital bed because prevention will dominate and will cure what is going to happen next. Secondly, when you talked about robotics has definitely worked very well because robotic surgery has reduced the length of stay. Because everybody is typically worried about two things: how long will be in the hospital bed. Secondly, what will be the scar looking like? Because everybody is today very clear that he wants the skin to be
Flawless.
scarless. So in that aspect, yeah, really MICS or something which is robotic surgery is really giving very good results, and we have adopted it a very in a logical way. And patients are also transforming to understand that okay, let's go a robotic surgery if it's available.
Sir, in the COVID era, telemedication was kind of famous. Has Apollo adopted it?
I think COVID changed our life because a lot of things were manual. Even the meetings were manual. So your physical presence was required if you want to do it in Bhubaneswar. And tomorrow, if there's a meeting in any different part of the country, you need to travel. So that part has really eased out. But then second part, which has been that you never know when is your next meeting because somebody will set an invite, and most of the times it's very difficult to refuse. So the calendar gets blocked for whole of the day. So that is one negative. But otherwise, ease of doing a meeting has become better. Ease of consultation has become better. So patients, let's say in distant far off from Bhubaneswar or any major in any state and periphery, can get ease of consultation and also an understanding with certain parameters that get evaluated, which is blood parameters, through an expert who is sitting at a distance, that what is the line of treatment that he has to adopt. That is the best way that we have adopted with us. We are also doing teleradiology, where a lot of load of radiology diagnosis gets evaluated centrally. So that is another major role that. And third is tele ICU, where critical care beds get monitored by a central team of experts who review for the patient who is at distance. So I think these three areas I would say has worked very well, and also in preventive medicine, where I shared that AI is dominantly working in helping in ease of diagnosis and predicting how far is the time when the danger is going to strike.
Now, since we are talking about telemedicine, has there complication ever arrived? And what are the system in Apollo to ensure that patient is safely diagnosed?
See, most of the things, whenever you are doing a diagnosis, compare with the systems that we have centrally or in a major unit like Bhubaneswar, we have all most advanced systems. So this is the receiving end. Now the transmitting end is another thing which is transmitted by appropriate bandwidth. But the point where it is originating is the key point because they need to actually capture the results in the right manner. Right manner in two ways. The blood parameters need to be analyzed properly. Secondly, the modality of capturing the films, which they might be having a basic, but it gives an idea in which the doctor's conclusion is approximately correct or mostly correct. Chances of errors are there, but the line of diagnosis and the plan of care is in line because it is not just one time monitoring, it is continuous monitoring. So, for example, in the hospital, when a patient is there, the doctor sees the patient in the morning, then he comes back to do a second round of consultation. Similarly, when the patient is in periphery, a doctor over there sees, communicates with the clinician centrally. So chances of error are there, but they are reduced.
Does Apollo encourage continuous learning among the peers, among the doctors?
I think everybody's phone does undergoes a cycle of a new software getting installed. So it is also learning. How can we without learning? So we typically have a very well developed systems in which we have one model like Apollo learning together. So for example, if a meeting is getting conducted of a committee or anything in my unit, somebody else from another unit would log in to the system and would review this. So that is a cross review. That's one way of learning, which we have to do 3 meetings a month. That I have to necessarily log into systems and see what is the schedule of another meeting in another unit and do it apart from doing my own. Second thing is we have a medversity which conducts programs which are of long durations or short durations or certificate programs. That enhances learning. Third is, I would say, we have a well developed learning systems in the hospital where we have a trainer, and the trainer is usually one who is an expert in teaching, takes classes at intervals, and I think with that, nothing is left out. We also have a centrally developed award rewarding systems for people who publish papers, people who write down books. So rewards and recognition gives everybody motivation to drive their learnings into papers, also their research into papers, and also in books, apart from the programs that we conduct.
Private hospitals often face scrutiny about affordability and transparency also. So, does Apollo address these concerns?
See, typically the channel of patient financials fall in four brackets. One bracket is patient pays out of pocket. So one who can afford definitely does it. Most of the people are shifting to a segment of insurance. So insurance base is growing, and that is one base which is actually growing to the extent that people are able to afford good healthcare. Third is corporates, which comes as an insured party to drive their accessibility and also to ensure that they take the best systems. So that is the third. Fourth, I would say, is a public system in which government scheme like Ayushman Bharat is giving leverage of to the poor section of the society to avail treatment in world-class hospital systems.
Sir, how do you respond to public criticism or controversy when it arises in the media or in the public domain?
So it's these are challenges which happen at times. So one strategy that we have adopted is communicating to the public, which is about the brand values, about our clinical outcomes, about the way our patients' testimonials talk around, about our doctors, so that people at large are informed of what we are doing in the market. I think that one is really has really made a good way to understand for the people outside in the community that what we are doing. Second is we send our doctors to the community where they do a community outreach program. Once they are doing a community outreach program, it builds a good connect with the community. So at large, people have the understanding that okay, Apollo is a super brand. It is delivering the best healthcare, which is not just in words, but actually in true sense we are doing it. But at times comes when criticism comes, and it comes because of certain reasons. So as a unit head, when I look at it, first important thing is take control of the team and yourself, because you have to balance it out, because the other party is trying to do something which is not right, but then you can't be fighting by losing your temperament. And I think most of the times with the counseling, I would say people come out of counseling and then they understand, the group understand that okay, let's calm down, let's understand why the thing went wrong. So we typically hold family meeting, because it's usually a story of patient doctor relationship or patient financial relationship, where somewhere the bill has gone beyond what he was expecting, and then he is not willing to pay the extra, so he is creating some other story so as to reduce the bill back. So once we understand what is the root cause, we address it. So either it's financial or it's clinical. Clinical is coming because the acceptance is not there, because once you come to the hospital you accept that you're given money and the outcome has to be the best. How will you expect that the outcome is not the best? So if the communication from the doctor or from the clinical team got missed of the changes in the trajectory or the course of treatment, or let's say outcome which suddenly changed, it was everything was going fine, suddenly the parameters deteriorated, and then you realize that okay, why this has gone wrong, everything was fine, something has gone wrong, they start evaluating, then a lot of things happen around that. So we try fixing that thing up, and I think that works well because it's a team effort which comes together. We bring our clinicians also, and we also involve certain counselors. It was all about mind psychology and how that mind psychology got disrupted because something didn't came on time.
So one question I would like to ask personally, like what lessons did you learn from COVID-19? Because it is something big that it took away 3 years of life from everyone in a blink. So how did Apollo cope with that?
See, nobody was prepared. So every day was a preparation day, basis what was happening throughout the day. Good thing was everybody came together. So the entire country, entire community, entire public systems and private system, there was no difference. And that is why we succeeded. That's one aspect of it. Second aspect, it made us learn that you should be prepared because you never think what can happen next. So, for example, a lot of people didn't have the capacity to pay, but then it was supported in one or the other way. And people moved into that era that, okay, post COVID, they started looking at insurance as dominant support for taking care of good healthcare or affording good healthcare. So that is one. Second important thing that happened after that is people started looking at prevention as a model, because somebody who was having cardiac illness, somebody who was having um, heart ailment or diabetes were more prone. So they started addressing those things in a preventive model so that they must know what is it if they are unaware. If they're aware, they should control it. So people became more conscious. I think that is true learning that I see in change when I look at my preventive health check, which earlier were very low before COVID, and now it is like overflowing. So at times we have to refuse. No, today the slots are booked. You kindly come on Sunday, or we'll hold you on another day. Third important thing I would say is the systems have become more robust in looking at certain infectious diseases much more proactively. So, what we were scanning before COVID-19 as a routine, now our panel has increased. So, we are evaluating even a case of fever much more intricately to assess to understand why fever came in. And so, we with other clinicians, they also never look at simple cough being only a simple cold. It can be COVID also, because still COVID is there in some form, but now people have got resistant or adapted or immune to handling COVID, which was not the case earlier. Yeah, but when you look at 2019 or 2020, still it's a terror year because we personally have seen so many deaths. We have seen people walking into the hospital, suddenly dying out, and a very young soul dying out is not a thing which anybody would accept. Be not a part of family, but a healthcare driver, or be a family. So that part has really given us a lot of good lessons to focus on certain areas which were earlier we were not.
What lifestyle diseases worry you the most among all that is present? Like this is something that is bound to happen to like 80 or 90% of the Indians.
See, we have seen diabetes growing, we have seen hypertension growing, heart attack coming. And when I say growing, it means earlier elderly people used to get heart attack. Today you find 22-year-old male coming with heart attack. That's a point of worry. I have never seen when we were studying in college ever thought of, okay, this food is not to be eaten because it's 126 calories or kilocalories. Today, when you go to eat a food, a hotel is not telling you that you eat the food. It is telling you this has this many calories. So, so I mean, it's not education. It's a index of fear. Secondly, you also start Googling to understand which food you should not eat or what you should eat. So life has become very complex in understanding how we should drive ourselves. And that is really a point which has caused misery in most of the mind, because stress was also not a factor earlier. Youngsters were more cool, calm. Today, you see a lot of anger roaming around in society. For a small um, hit on the vehicle, people come on creating a lot of ruckus on the road. The society was earlier very cool. So I think a lot of things have changed.
Since you're talking about heart attacks, what are the early signs do you think that uh, these are the signs and people should be conscious
I'll
about
give you
it?
my best learning example about heart attack. And it's not of this 5 years, it's 20 years ago. I was an administrator then also. So early morning, the case report usually happens of the night. This gentleman that I'm talking around was around 26 years old. He came to the hospital with pain abdomen. So typically, a pain abdomen, nobody would like to be called that you're diseased. Even if pain abdomen is there, people will make their own diagnosis. Oh, this just something like gastritis. So this gentleman walked into emergency and said he has gastritis. So doctor examined. After about 20 minutes of evaluation, doctor told him, the CMO told him that we will evaluate for next 24 hours by keeping you in ICU because you might be having a heart attack.
Right.
So as being 26 years old and then being labeled as you are likely predicting the person to be heart attack, he said you are trying to earn money because I don't have heart attack. As a process, the CMO made the register signed by him saying that you are refusing admission. He said, fine, I'm refusing admission. And I must have left the hospital after 1 or 2 hours because the pain got slightly settled and went back. Morning report, when we reviewed, that guy came back to the hospital around 1 after midnight. And he shared that whatever you want to do, but ease out my pain. So again, the same analysis happened in 20 minutes, and he said that you have frank heart attack. We'll take you in cath lab. Had you not come in this window period, we can't expect what kind of complication because it's not a small, it's a major one. So really that picture which CMO described to us in the morning report, he said, whatever you want to do, but please bring me out of this situation. And I can say we don't know the post, but he walked out of the hospital. That's what I know and I remember. But thankful to the doctor who labeled him saying that he's having a heart attack. So today when I say that chest pain, which people understand, okay, is a heart attack, typical symptoms may be there, but atypical are more common. Like pain abdomen, suddenly fingers having pain, even any other form, sweating, generalized sweating. I mean, sitting in an AC, somebody sweats. So when that as a sign can be looked as the patient may be having heart attack. In the story that I shared, the only factor which was involved in that was the case of him having a stress. Stress was so he has taken a loan and the loan was not getting repaid. So typically he used to get calls of loan payment and that was not easy to handle. So he got into so high stress that he had a heart attack.
Talking about mental well-being and awareness, so how do you think India is coping with that?
I think it's my opinion when I look at families. We were earlier having joint families. That means in a family, typically you had 10 to 20 members. So a lot of nurturing happened inside the house. And a lot of mind strengthening used to happen inside the house because somebody or the other was seeing what you are doing, right? Today we have become nuclear. A typical family would hold parents, their two sons. Maximally you go their own parents, so six. And six, since the parents are working, they don't have time for the kids, neither for the father. So they typically move out. So that kind of connect which was earlier has gone out in totality. Secondly, when I look at community, earlier community was horizontal. That means typically flat houses, ground floor, first floor. Today it is multi-storied. So everybody is residing in residencies, right? Very posh residencies. But those residencies are not giving you a connect with the people in the neighborhood. So neighborhood is not connected. So typically staying alone, what kind of psychology a person would come up with if the person is retired or if the child is by himself or herself? Typically he'll adopt to AI or mobile. And that kind of psychology is very weak because you are run by machines. You are not run by the family, which had an important role for keeping you alive mentally, physically, emotionally, and also in the society. When you go and learn in the school, you come out as a bright child. So I think that's a loss that we have incurred because that family time has gone very small.
Has there any cases that have really given you creeps, like horrifying cases that you have witnessed till now?
Yeah, I remember many times earlier, trauma used to be one horrifying. I still remember there were four gentlemen, youngsters, college going guys, two from a rich family, two from a poor family. They were driving at speed of 100 plus on a road which was not a main road. And suddenly a bus came in and there was a head-on collision. The two that were driving were so badly injured at that point that by the time they were brought to the hospital, they were dead. What was really not good to see is those coming from a poor family. The parents said, my son never had an opportunity to drive his own car. Now, what kind of nights I'm going to spend when my both the sons have gone? So these are one of the moments. But good thing is that over the years we have focused on trauma in the public systems. So trauma has come down. We still see accidents, but that are usually either due to fog or somebody driving under influence of alcohol. I think we need to strengthen our systems by saying that alcohol is not the right thing to do, and then they have to drive in speed limits. So if people start following the rules, we'll see it less of it.
Finally, what message would you like to give to listeners about health and responsibility and hope? Since we talk about the trauma and starting from administration to medical preventive cares, so what message would you like to give to our listeners?
So today we are looking at expanding hospitals. Okay, we talk around new hospital is coming up, which is 1,000 bed. New hospital is coming up 500 bed. So are we dealing with the problem, or are we saying let the problem grow and we are growing the hospitals? That's my first question. And why I'm saying so, because most of the times we want to say that let's not grow the hospitals, let's grow a healthy society. And when you want to say a healthy society, it only can come when you focus on prevention. That means every person in the community must undergo a health checkup. I think that's one thing which is missing in the context of most of the community. And that's why they report disease suddenly, because they have not undergone health check. Because health check, if you undergo, you will come to know of what parameter is going out of range, and then you take care of it because the consultation will happen on time. So my message would be, please ensure health is wealth. It should not be just a saying which we know, but we don't know what does it mean. So if every community can ensure that the individuals living around them in the family are undergoing preventive health checkup, it will be a lot of good outcomes in driving healthy society and a healthy India. Second thing, when I want to say as a message is, whatever you're doing, be satisfied. Because today, most of the society people, we talked about what is the ailment which is having mortality, means ultimately causing death. We talk about heart diseases, we talk about hypertension, we talk about diabetes, but we fail to understand something which is a psychology is unaddressed. Because psychologically, depression is one. You see a lot of people unhappy. I think morbidity has an important role where we must understand what individual would be needing so that he's happy. Because a happy individual does a lot of good things rather than a person who's not happy. So I think there's a greater role for us to take care of the family, which we don't have time. As I said, being working as a CEO, I ensure that I spend some time with my family every day. And that means a lot, because the kids look upon you not just as a father, but a father who has a time for the kids, time for his wife. I think that's a lot important thing, because I've seen people coming to hospital because either they're depressed, and it is not good to know that a youngster getting into depression is really not a good sign, because antidepressants or whatever medications you take, it's not going to take you through a long journey, because the best medicine is your family, who can nurture you, take care of you, because every family, every member can have an up and a down. And when you are down, your family has to hold you.
Thank you, sir. That was wonderful. Thank you for your time. Thank you for the wisdom that you share. And to all the listeners that who are watching this show, watching our OP podcast, stay tuned to Odisha Post Live for more such updates. Thank you.
Thank you so much.